everyone. Welcome back to the IMG podcast. I'm your host, Dr. Sammy Khalili, and I am beyond excited to be here with you today. As last episode, we talked about myself and my journey of how I got into medicine. I alluded to that we would have a special guest here today. I'm beyond thrilled and excited to introduce you to my good friend and colleague, Dr. Neil Mundi, who's our division head and Chief of Oncoplastic Surgery here at IMG. And we are here to kind of learn about his journey of how he got into medicine, but also talk about some other topics as well. So let's get into it. Hey, buddy! Welcome to the podcast. Super happy to have you here.
Thank you.
Super excited.
Appreciate the invite.
Oh my God! Beyond thrilled to have you here. So, as you know, this is really meant for our community people here and to get everyone to get to know us, and also then have the opportunity to ask us different kinds of questions and thoughts about stuff in general. So the first thing I wanted them to know about you, I know your story, because we're good friends, but I want them to hear how you ended up in the pathway of going into medicine. You are Canadian like myself, but we are not from the same parts and didn't come from the same background. So why don't you tell everybody how you got here?
Sure. So, as Sammy mentioned, I am Canadian. So I was born about an hour outside of Toronto, Ontario, in a place called Kitchener-Waterloo. Was raised there, did my undergrad at the University of Waterloo.
Just for you guys to know, Waterloo is a wonderful university in Canada. It's the place where BlackBerry, the phone company, was birthed. And I don't know if they're still running now, but they still have a presence of some type.
They are, but they just don't make phones.
Yeah, that's
they
right.
do other stuff.
That's right.
But yeah, really tech-heavy kind of
Very
thing.
much so. University of Waterloo is like the MIT of Canada, if there's a better way to kind of describe it, I guess.
I think that's a fair assessment, for sure. So ended up doing my undergrad at Waterloo. So, you kind of asked how I came into medicine. I wish I could tell you that I had this aha moment that, I got called to the field of medicine, but it really didn't happen that way. It was kind of a slow process for me. So, when I was growing up, I didn't really know what I wanted to do. To be completely honest with you, I wasn't a great student either. So kind of went through school, didn't really have a particular subject that I was interested in or that I liked a lot. At one point I flirted with the idea of being an engineer, but then realized I didn't really have the enthusiasm for math and physics that you kind of need for that. So, a couple of my friends decided to do, health sciences. A few of them were dead set on medicine from like grade 9. So kind of followed the crowd and said, okay, I'll do health sciences too.
That's very common for a lot of people, where some people are knew that that's what they wanted to do, but I have numerous amounts of friends like yourself who just they didn't know right away, and that's totally fine. It's very actually healthy because you end up discovering yourself as you go along.
Yeah, absolutely. And even in undergrad, it was just through some volunteer experiences again that they were doing in the hospital, and they were working. There was one program with patients who had heart attacks and strokes, helping with their rehab and that sort of thing. So I tagged along on those volunteer experiences, and then I kind of got to see some of the relationships, especially between physicians and patients, that I had never seen from a third-person perspective up until then. And I really saw the trust that develops in that relationship and how special it was. And so that kind of sparked the interest for me. And from then, I kind of went through the rigmarole of, prerequisites, MCAT, all the rest of it.
It sounds like, at least at some level, as you were growing up, you really liked interacting with people.
Yeah, absolutely. Yeah. And I think that's one thing that, is such an integral part of medicine, no matter what specialty you're in or what you do. And not only for MDs either, whether you're a physical therapist, social worker, speech language pathologist, it's an integral part of all of healthcare, which, like you said, was something that I was always interested in. So that gelled really well.
Excellent. Right on.
So medical school at the University of Western Ontario in London, Ontario, so about another hour west of where I grew up.
So for you guys to know, here in the United States, it's about 2 hours east of Detroit.
Yeah. In medical school, the first thing that a lot of upper year medical schools students told me was, you want to differentiate between surgery versus non-surgery. That's your first thing that you should try to figure out when you're in medical school, because those trajectories are a little bit different in terms of how you prepare for residency and things like that.
Yeah, that's a bit of an accurate statement, because if you can compartmentalize parts of medicine, that's
it's procedure, not procedure, and
Yeah.
that's kind of where you start with that question mark, I guess.
Yeah. And so I asked, so how do you make that determination? Because in the first couple of years of medical school, you're in the classroom, you're doing anatomy labs, you're listening to lectures, and doing that kind of thing. So
the buzzword they use in medical school is didactic.
Yes.
Which is a fancy way of saying, yeah, you're in the classroom.
Yeah.
That's it.
So it's in a way, it's kind of an extension of your undergrad in that way. So they said, reach out to surgeons. Go online, search up different surgeons, send emails to their administrators, and see what you can do. If you can shadow them or spend a day in the operating room or what have you. So I ended up doing that, and I ended up reaching out to a cardiac surgeon. And I arranged to observe coronary artery bypass surgery, which I thought was going to be really cool. I was really excited. Read up on the procedure a little bit as much as I could to try to prepare myself, and ended up going to the operating room that day. And I'll tell you, it was like the worst experience I ever had. It was just.
Now you got to tell me why. That's interesting.
So from the top down, from the surgeon to his fellow to the residents to the medical students that were there that were more senior than me, everybody treated me like I was an afterthought, and I just felt like I was in the way the whole time. And so
anyone who's been in medicine at some point, that has happened to everybody.
Yeah,
no question.
Yeah. And so I left that day just kind of feeling bad. Did not enjoy the experience, and I was like, maybe surgery is not for me. If this is what it's going to be like, if that's what the environment's like in the operating room, and that's where you spend so much time, maybe I should reconsider. Maybe I should go the non-procedural route. So after that, in the summertime, after my first year, there was a research program through the medical school, and I just looked at the list of projects, and I saw one that sounded kind of cool. The title was something like Oncolytic Pox Viruses for the Treatment of Anaplastic Thyroid Cancer. So a lot of big names, a lot of, anaplastic thyroid cancer is a very aggressive form of thyroid cancer, and I'd never thought of viruses being able to treat cancer. So I ended up signing up with that project, and that was a project that was led by one of my mentors, Dr. Anthony Nichols, who's a professor out there at Western now.
Shout out to Dr. Nichols, who I do know very well and is a wonderful man.
Yeah. So ended up going to his lab, and then at some point during my summer there, he invited me down to the operating room to watch a surgery where they were going to remove a tumor from a patient's jaw and then rebuild the jaw with bone from the leg. So, I went down, and, based on my previous experience, I wasn't sure what to expect. I didn't have high hopes. I kind of thought I'd be stuck in the corner again and just trying to stay out of everybody's way. But it was the polar opposite of what my experience was. Everybody was super nice. Everybody was trying to keep me as engaged as possible, asking me questions, really making me feel as like I was part of the team, even though directly I wasn't contributing anything to the patient's care. And, we saw that surgery. I left the operating room, and I said, man, I have to learn how to do this. To take somebody's, a part of somebody's face that has a cancer in it, and then to take bone from another part of their body, carve it in a certain way, fix it with titanium, hook up the little blood vessels, and have it revived and now become a new jaw. I mean, to me, that was just amazing. Had no idea that was possible. And so
that's the wonder of head and neck reconstruction. When the first time you see it, it's always very sexy.
It's a magical.
I know it doesn't sound like things you probably say would be sexy, but it's a very sexy operation.
Yeah, it's a magical thing to see. So from then, being in that environment with those ENT residents and the rest of the faculty, I loved it. And I really fell in love with it. And so I applied for residency, ended up matching to residency at Western. So I was there again for 5 years. And again, like we both did the same residency program. And I think you would agree it's second to none in terms of surgical training.
1,000%. We're not saying that because we both went there, but just you probably feel this way. It's like you come out of that training program at Western and there's nothing you don't feel prepared for.
Yeah.
Zero. It doesn't matter what it is that's coming through the door. And whereas other people, I would see them panic or whatever else. We had seen so many awful things all the time. Not in a bad way, but for our learning.
Yeah.
That we were prepared. It didn't really matter what was coming through the door.
Yeah.
So I still think we feel that way.
Yeah. No, absolutely, 100%. And it's not for lack of hard work. I mean, that's what makes that program special, is because you work like a dog for those 5 years. But at the end of it, you're way better for it. And so, my interest in head and neck oncology and reconstructive surgery kind of just blossomed throughout residency. And then that's how I ended up at Mount Sinai, New York, in my fellowship.
And this is me as his friend and colleague. he didn't just end up at any program for his reconstruction fellowship. In the world of ENT, he ended up at one of the best programs worldwide for reconstruction. And it's with one of the people, Mark Erkin, who is a massive pioneer in the field and has been at this for, 30 years or so?
Yeah, 30 plus years,
Yeah.
and he's had a whole lot of fellows, and obviously a really big wealth of experience. And he wrote the textbook, on head and neck reconstruction.
Literally wrote the textbook.
Yeah. So that year was tough, I will say. It's a very highly regarded program, and one of the things that it's notorious for.
It's not touchy-feely.
No, it is known as the toughest fellowship in terms of your lifestyle and work hours. And I'm talking 365 days of that year on call, rounding every day, no vacation. So you're fully immersed in, the head and neck cancer, advanced thyroid surgery, transoral robotic surgery. And so again, kind of similar to residency, you come out of that and you're bulletproof. You can handle anything that the world throws at you. And so after that, my job, my first job was in Springfield at SIU.
Shout out to the chair, Dr. Dana Crosby, who was a good friend of mine. She's wonderful.
Yep. And so spent a year and a half down there and developed a fairly busy practice right away, just because, Springfield's not a big place, but it serves a really large area.
Yeah, they have a big catchment in that area.
And so there's a lot of head and neck cancer patients down there that need care. And so I was quite busy down there. And, then the opportunity arose, obviously, to come up to Arlington Heights to join Intent Medical Group and to build a head and neck cancer program, which is, it's not an opportunity that's afforded to somebody at my career stage very often, if at all. So obviously, immensely grateful to you and to Dr. Kassam for taking the leap of faith for getting me up here. And I think that, I'm extremely proud of what we've built, which, we'll tell you guys all about, but it's something that's very special.
Well, we're beyond proud to have you. There's no question about that. You're on an island down there by yourself trying to be there, to help with everything that's going on. You come up here, and I told you, I said, you're going to see things here that you haven't seen anywhere else. And I could tell in your face, you're like, come on. What do you think the first time you kind of came up and hung out with us and saw, got to get us flavor of how we do things here together?
So what I saw here was completely different than anything I'd experienced before. And, you did mention it to me a few times, and I did write you off as blowing smoke, but it's the real deal. It was everything. It was from, the patient care model to the support staff that we have here, to all of the resources that we have. It's healthcare on another level. And I think, people talk a lot about patient-centered care, but it's kind of become just a catchphrase now. It's thrown out without much feeling behind it.
That's very true.
Or much meaning behind it. But I think we live it here every day. And, I think that the patients, when they come and see us, they pick up on it right away.
So the Intent Medical Group model is not like something you'd find anywhere else. It's an extremely integrated model across specialties. So meaning that you're seeing everyone all at once at the same time here, which you'd agree that, as a patient, they love it because they don't have to go anywhere. They just go once. They have all their questions answered. Because you can even tell that they're not used to it because of the questions they ask you at the end of the visit. Of okay, so when do I do this and when do I see this person? I'm like, you just did. They're right there. They're right there. They're right there. Everyone already. We just had the discussion right here in front of you. You understand, and they're like, oh, and they realize everything's already happening at a much more accelerated pace, and they're not used to it. And then they come in and come see us, and they go back and access a different system when they go get a second opinion. And they're like, oh no, they don't want to deal with that anymore, no matter who the expertise on the other side is. So it's been a wonderful thing, at least from my perspective. I don't know, you'd agree.
No, I think so too. And I think that what's really refreshing is that, when you have all those different specialists in a room, the patient is actually there while we hash it out. If there's a controversial kind of opinion about how to move forward with the treatment that one person is proposing, we'll have it out in front of the patient, not in a rude way, but we'll debate it, we'll kind of reason it out together, because that's what you want. You want the experts all together having that chat in front of the patient, so the patient can say, oh, well, what about this, what about that? It's a way that really brings the patient into decision making that they've kind of been sequestered away from in a lot of medicine for a long time.
And the same thing with their family, because their family is very much often involved in their discussion. I mean, I think the best analogy for everyone to think about it is, and I've used this because it was given by Dr. Sam before, but it's a great analogy, is that we are the board of directors, and the patient is the chairman of the board. They can fire us at any moment in time and tell us what they want. But they're in the middle of the entire directive process. So I think that works.
Yeah.
Do you remember what our first surgery was?
I do. So the first surgery that we did together was on a patient that actually I'd originally seen at SIU. And he was a patient that I originally met maybe a couple of weeks before I was leaving. And so when I left SIU, there wasn't anybody there who was performing transoral robotic surgery, which is a minimally invasive surgery that's done through the mouth for cancers within the throat. And so I was the only person at SIU doing that surgery.
To kind of give people context, that's like basically you're using a special robot with special arms that are going into the mouth to prevent us from doing massive cuts on people's faces to get to spots that we couldn't get to before.
Correct. Yeah. And so, that robot is used very commonly in, gynecological surgery, general surgery, thoracic surgery, and now it's really becoming popular in head and neck cancer surgery as well. So I told the patient, I'm happy to refer you elsewhere, but you won't be able to get this done at SIU because I'm leaving. And he said, well, where are you going? And I said, well, I'm going up to Arlington Heights. It's about 3-4 hours away from here, so I'm going up there to start a program. And he said, well, I'll just come up there and I'll get you to do the surgery for me. I said, well, all right. So we, made arrangements. Again, goes back to that team. Our team of nurses is fantastic. They were able to make sure that everything was okay with insurance. They helped him out with transport. They got everything arranged, so he came up here for a surgery. And so, we took him to the operating room. We did his robotic surgery, which went very, very well for him. He had a great outcome. And happy to report that, as of, just a few weeks ago, he's been doing fantastic. And he's back home now and he's doing very, very well. So that was the first surgery that we did together. And I remember that when I first came here at NCH, nobody was doing robotic surgery in the mouth either.
Nope, not a soul.
And so we kind of had to go through that process of getting everything credentialed and getting all the privileges set up and everything. But, with our administrative side, that was a piece of cake. What would have taken 6 to 12 months took maybe a week or two.
It wasn't too long. It wasn't too long. And that's a testament to you and your gusto, but also a testament that the patient themselves had such a good relationship rapport with you. They said, forget it, I'm going to drive the 3.5 hours to come and see you, Yeah. I say that because many people may not know, in other areas, like in the country, people are totally willing to drive a long distance. If anyone who lives in Illinois knows, the people who live in the rural parts of Illinois absolutely hate driving to Chicago, and they cannot stand it. And so for them to come in for their health care, it either is because they really like the individual or it's because they have nowhere else to go. And in this case, it's because this guy had other options. He could have gone closer to St. Louis. He could have gone somewhere else.
Yes.
But he came because of you. So that's a testament to you, buddy. Well, buddy, it's been phenomenal having you here. I think everyone really has benefited from learning your journey, how you got here. And I mean, you don't have to tell me you're my friend, and B, you're my partner. But I really do think that people, I hope they have gotten to see you the way we see you here, as a phenomenal resource and an amazing asset to the community. So welcome and thank you, and I look forward to us chatting a lot more about other things that people can learn from.
Yeah, absolutely, and thanks again for having me. It's always nice to catch up, and I'm looking forward to where this podcast is going to go, and absolutely I'll be back to talk about some more stuff with you.
Awesome. So everyone, tune in next time for another episode of the IMG podcast. Make sure to like us on all of our social media platforms, anyone that you are using, and to like and subscribe on YouTube. And please, 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 I think this is the most important part, add your comments and questions or thoughts in any one of the social media platforms. We do follow up on them to see where we should go next, to know where your interests are, so we can answer your questions that you have had burning in your head that maybe don't make sense to you and you'd like to know more. That's what we're here for. Thanks again.